Health inequalities are unjust and avoidable differences in people's health across a population and between specific groups. These differences do not occur by chance. They're influenced by things like how much money people have, where they live, and what background they are from. Did you know that in the most affluent areas of Scotland, people experience around 26 more years of good health compared to those from the most deprived backgrounds? We wanted to explore how young people understand and perceive these differences, while also increasing awareness of how place and circumstance affect physical and mental health. Children in Scotland has been funded by the Wellcome Trust to carry out a participative research project into health inequalities in Scotland, with children and young people aged 10 to 18 living in Glasgow and Dundee to learn from their experiences. The young researchers chose 3 key areas they felt were important to look into: safety, family and friends, and littering. Our research consisted of group discussions with people in our schools and exploring the communities we live in. We also thought about how different parts of the community made us feel. Safety. When looking into safety, the researchers identified themes that related to how safe they feel in their communities. We heard examples of people engaging in harmful behaviour relating to alcohol and drugs in the area. This included the presence of smashed bottles and items for taking drugs. "I just want people to stop throwing pills on the ground," said one participant. They spoke about how this behaviour could lead to premature death and an impact on mental health. They also felt people could get used to it happening and start joining in. The researchers commented that knowing this behaviour is going on in the community could affect its reputation and also mean people avoid certain areas because they felt anxious or worried. We also heard about an awareness of crime in the area, with the presence of gangs and knife crime and fears about fighting making people feel scared in their community. One researcher recalled, "My brother was playing football and strangers said they would bury him." They also mentioned robbery being a worry. We felt this might make people feel stressed and suggest they don't always trust people in their community. Family and friends. When we talked about family and friends, the researchers discussed how the activities they do with those closest to them can have an impact on their health. Fast food was a common activity with friends and families. We heard about this in our focus groups and saw evidence went out in the community. We talked about how it was unhealthy but still popular. "The food tastes good, even though we know it's not good," as one participant said. They talked about how bad eating habits could contribute to being overweight and developing illnesses such as heart disease. They also felt having lots of access to fast food might mean young people get used to eating it regularly, and this becomes normal. Though food and retail stores were common in the community, we identified that there are few options for them when looking for free or cheap activities to do in their spare time, and we're worried that this might mean some people might miss out due to cost. Places such as the cinema are great to have nearby, but the expensive price of tickets means that it's not accessible for everyone. The researchers felt that a lack of cheaper community spaces and activities could lead to people engaging in riskier behaviour elsewhere. Littering. Littering sometimes made people feel embarrassed or ashamed about the area that they live in. The researchers suggested that people litter because they don't care, which might mean they don't care about the community more widely. We noticed abandoned furniture in public spaces and spoke about how children could get hurt by playing with these objects. It was also discussed how a build-up of noticeable litter, including dangerous items like broken glass, could make people feel unsafe or give the impression that the area is unclean. We felt this might give the area a bad reputation or affect people's mental health. Excessive litter can also make people feel self-conscious about inviting friends round, meaning people may see their friends less. When walking around their communities, the researchers saw a number of abandoned spaces in both areas and talked about how they might contribute to people getting hurt. They also saw overgrown green spaces that contained hazardous materials such as animal waste and felt this could endanger the health of children playing within the area. The last point raised was that these wasted spaces might make people feel bad about the area or also make them feel unsafe. It became clear throughout the project that the researchers enjoyed working together to encourage conversation and change in their communities. We also enjoyed learning new things and getting to look at things in a different way. There were things the participants liked about their community, such as going to the park and enjoying time with family and friends, but there were also parts that we wanted to change. This active participation throughout the project helped them to draw some conclusions and formulate some recommendations on how to improve their communities. For each key area of the research, there were a number of proposed solutions and recommendations. More funding for services to support children, young people and families locally. Make green spaces and parks feel more accessible. More police and other responsible adults to help children and young people feel safer. Make bus travel cheaper. More free or cheaper activities for children and young people like youth clubs and football pitches. Make use of wasted and abandoned spaces. Provide opportunities for people in the community to build relationships through local events. And have healthier restaurants and food options in the area. This animation was the format the researchers chose to showcase their findings and was created in conjunction with a full report, which is available on our website at www.childreninscotland.org.uk.